he is the only one out of his litter that doesn't look great. He kind of had some gunky eyes. He had a little bit of nasal discharge. He's pretty dehydrated and just kind of lethargic. We did send out some poop for testing. We are a little concerned about feline panleukopenia virus, which without treatment is fatal. So, and unfortunately, if he has it, then typically you see one kitten at a time get it and they all die, which would be horrible. So we are keeping a very close eye on Chicken Nugget, giving him some meds, trying to give him fluids, keep him lively. So he doesn't look great today, but we're gonna go give him his fluids for the day. He is eating and everything, so he at least has an appetite, but you can see him, he just kind of a little lethargic. His siblings are all very like bright and wide-eyed, and he just kind of sits in the corner and doesn't feel good.
Hi, buddy. Oh no. He does not look too good.
You look great, bud.
So little Chicken Nugget is not doing too good. He's pretty lethargic. And we're looking up the panleukopenia, I think. So what are we doing with Chicken Nugget?
I am just setting him up in a little cage because he's gonna go home with me.
Awesome.
Just so he kind of has closer monitoring, can give him fluids and stuff more often, especially through the weekend, because we only have staff come in to feed and clean once a day on the weekends, and he needs a little bit closer monitoring than that. So we'll take him home and see if he does okay.
Sounds good. Thank you for doing that. Poor buddy's so lethargic. It's not good. So, update on Chicken Nugget, the little kitten that we were taking care of here. Nicole was so sweet and she brought him home over the weekend, and unfortunately Chicken Nugget passed away on his own. So he is no longer suffering, so that is really good, but he did die on his own last week, so that is really sad, but we did our best to try to save him, and now he is no longer suffering. So that's really good. We still have the 3 other kittens though, and they're doing well. So we're just keeping taking care of them, and I'm sure they'll get transferred out to High Forest sooner than later so they can get adopted. But yeah, unfortunately Chicken Nugget did not make it, but just wanted to update you guys on that.
All right, so this is the week of buyout. We're finally at the last day. Just kind of getting wrapped up and ready for the weekend. Unfortunately, or fortunately, depending on how you feel about me, this is my last in-person day at Horse Plus. I will still be doing some telemedicine work and things like that, kind of coming in and out as I'm able, but I am going to a residency and master's program at a veterinary teaching hospital in Virginia. So I won't be here in person, but I'll be communicating with them and helping them with cases and things like that as they need me to. So you may or may not see me on computer screens or hear my voice in recordings and things like that when we're talking about cases and things like that. But I've really enjoyed my time here in person, and I've learned a lot, and that's going to help me in this residency program to help future veterinarians that are going out there into the world and maybe helping them be aware of what's going on in the horse world and things like that. So I'm excited for this next chapter, also a little sad to leave, but I'm still going to work hand in hand with Horse Plus and help them out, and they're going to help me out too. So it's going to be a great thing going forward, and hopefully after 3 years, if they would like for me to come back and there's a place for me here, depending on how they grow over the next 3 years, because they're growing at an exponential rate, which is great. So who knows what they're going to be into in 3 years, but looking forward to the future, and hopefully I can help them out with some cool cases and learn some new treatments, and we can save more animals.
Yeah. This is, I believe they pronounced it Reesei. She came in yesterday while Gina and I were up finishing buyout. Don't know her full background, but they are pretty confident she's pregnant. So we are going to x-ray her to see if she's far enough along for Megan to take her. Usually around 45 days, you should be able to start seeing the bones of the babies on an x-ray. So that gives us a good indication of if she's before 45 days or after 45 days. And usually it's about 60 days to labor. So we'll see how many puppies you have in there maybe. She's very sweet though. Yeah. I'm gonna lay down. You ready?
She's so good.
She's a very good girl.
Yeah.
Okay, ready?
Just so hopefully you don't have storm, right?
Look.
She's like, what?
She's like, I don't understand.
Do you want to stand up then? Okay, let's take that foot off. Good. You can stay there.
Yeah.
Very sweet.
I see some. There's a lot of other noise in the way. I can start to see a skull on that side.
Oh, yeah.
So we can try for a lateral. Might have changed my settings. Good mama. You didn't hurt.
Good job.
Yep. You can see them.
Yay.
So she's definitely 45 plus. See?
Whoop. Oh, Ellen's good. Ugh. Oh, it's dead. Good. Oh, look at your babies.
Can we see? See all those little baby skeletons? Yeah, so she's closer to whelping than not.
Okay, come here.
Not actual rabies. We don't want
Oh,
that.
we're gonna lay down.
You got to flute.
The belly's pretty big.
You got to flute. Good girl. You're so good.
Good job. That was it. We're all done. Go back in there. Stop over here.
Alright, so we just got done looking at Reesei. She is a dog that came to us yesterday. She was highly suspected of being pregnant. So we took some radiographs today to see if we could see the skeletal formation of her babies, because that usually happens at about 45 days, so you know in gestational age how far along they are if you don't know the date of conception. So her babies have their full skeletons, so she is 45 days plus, and dogs usually whelp at about 60 days or so. So she's closer to having her puppies than not. And Megan is willing to take dogs that are pregnant that are that close to having their babies. So we're going to communicate with Megan today, tell her that she's fully vetted, she's doing great, and she's ready to go until she has her puppies. And then once she has her puppies and they're weaned, Megan usually brings the dogs back to us and we spay them. So Reesei's a really good girl. I think she's highly adoptable. I'm hoping she'll find her forever home once she has her babies, or maybe someone wants her with her babies. But she's a really good girl and we really, really like her.
You're a good girl.
Our team is here this morning. We are grieving the loss of Dr. Gina because we're so proud of her. She got her dream residency. We have Dr. Alex here today. Alex is a senior vet student. And she is here with us for 3 weeks doing an externship to learn more about shelter medicine. She's going into equine practice. So we're thrilled that she's here. We're forcing her to do some small animal surgeries today because we like to torture our vet students.
It's only like this.
I'm just kidding. So we have, I think, 2 kitty neuters and then 4 kitty spays, and then we're going to move on to do equine cases for the rest of the day. And what I'm looking for is an incision that's just barely large enough to let my testicle out. And I like to push them out because that inherently provides some hemostasis to those little vessels. So, go for it.
This is our fresh
That's
blade,
your
right?
fresh blade. Yep. And if there's anything you don't like, table height, light, whatever else it is, you're the boss.
Well, this is good.
Yeah, so a tiny bit more towards you.
Like,
Perfect.
doot, doot,
Right
here.
there. Yeah. Beautiful job. So push that sucker out. That might be enough. Yeah, you're good.
That's definitely
Awesome.
enough.
So the way I do it is I go straight in, I do my next incision.
Okay.
You don't have to do it that way. I just like to do it because it saves me from putting the scalpel down and picking it back up. I don't do that with horses though. When we do horse castration.
I can't imagine that.
Yeah.
That working very well.
Well,
it's possible, I
It
guess.
is what it is.
Right about there.
Yeah, you're doing a great job. You're being gentle but confident, which is exactly what we want. Awesome. Pop it out. Perfect. So this one is a tiny bit open.
Yeah.
Probably we can finish it, but if it does open all the way, it's still a
Got a
closed
little
as
bit of
long as you incorporate the tunic in your knot.
Navigation.
Yes. So
Water
next you're going to
navigation.
just pick a testicle and you're going to gently push, not pull, that tissue down. I handed you two maybe. Sorry. We get a lot of donated 4x4s and like weird textures and stuff, and I use them for stuff like this. It is funny though how using a new something, like a new brand of scalpel blade or like a new kind of suture will really be
This
like,
feels totally
this
different.
is not what I like.
There we go.
Beautiful. You can feel it, right? Like you can feel when it gives way. And as soon as it gives way, then you can do a little pulling. Excellent job. So now you have a lot more to work with for that knot, right? Mm-hmm. Let's talk through it one more time.
Yeah.
And I'm going to try.
This vexing knot.
I'm so sorry. I don't think I can do it left-handed. But it
okay.
shouldn't matter, right? It
Yeah,
shouldn't
it
matter
shouldn't.
because it's just a
It's-
different hand.
yeah.
So we're going under. So you start by laying it across and you go under. So that's number one. And then, see? Everybody drops it.
Well, now you're
So-
trying to do it slow, and
No,
then
you're
that
good.
makes it harder.
Under, and then open just a little bit. And we're tucking our testicle through that top part.
Yeah.
So let's do it again. Under, open, tuck it down. It's so slippery, and it like somebody that does it a lot makes it look like it's an easy knot, but it's not an easy knot. But if you get this, you can auto ligate all kinds of stuff with this. This is also the same. Yep.
Hang on, I'm going under towards
Perfect,
the
yes.
body. I think this was our issue.
Beautiful.
Before.
You did it
Because
perfectly.
this should work
So
now.
open, tuck the testicle down through the tip.
Yeah, there we go. I think that's what I kept screwing up. I was
Perfect.
going under, like, towards the testicle.
So now,
Yeah, this
tiny
should
bit of
work now.
feedback,
Mhm.
right? If you clamp all the way down here, you have to push it all the way off. If you slide oh so slightly closer to your tip with all of your tissue, perfect. Now clamp.
There we go.
That was like
Voila.
really nitpicky. You could have done it the way you had it, but now you have a little bit more
That was a
space.
Good tip.
So you can put everything down now, and you're gonna pick your gauze back up, and you're gonna slide that off to tie your knot.
Boop.
Beautiful job.
All right.
You can put it wherever you want. Good work, good work. When I do spays, I like to leave a nice big piece up at the top, but with neuters, what you did was perfect.
Okay.
Fantastic job.
You got it. There we go.
I'm sorry my voice is really loud. Had a lot of doctors tell
That's
me
good.
like why I'm so loud, and it's just the way it is.
No, I think it's great.
It's okay. I'm like a loud, like,
Love it.
I don't know how to shut
Nicole
up.
texted
so.
me yesterday like 15 minutes in, and she was like, "You're gonna love it, Alan."
Like, yeah, that's a green layer.
She's loud and obnoxious.
Perfect.
It's great.
Okay, so we're gonna go for the other one. I like to like at least dunk in between.
Okay.
The only way to learn what something feels like is to feel it.
Feel it.
And what you don't want to do is be super aggressive, because you can't actually just rip these off, and then you got to go digging for them, right? So you're
That's
doing a
not
great
good.
job. There's a lot of things you can learn from a book. So theoretically, you could tie a knot with that, but you're
Yeah.
right that like just a little bit more is going to make your job way easier. And it's okay to put a little bit of traction on. Just perfect.
Ah, there we go.
You're okay.
Ah,
You're great.
it definitely. We made it now. We're
Okay,
good.
great.
Okay.
And we're not open, right? Like we got a tiny bit
Yeah,
open, but you
but
did it. So
the
that was
rest stayed
fantastic.
intact.
And even if we were open, it wouldn't be a big deal.
it's
But
not
you
gonna-
are good to go. I'm gonna try to keep that anus out of your
Okay.
surgery field.
No, hang on. We do it. Holding it the right way around, and then
Beautiful.
go
Yes.
towards the body.
Yes.
That was our. There we go.
Nailed it.
I just have to remember towards the body. and
Nailed
then,
it.
like, I think we're in business.
Nailed it.
All right, and then try and scooch it towards
Just
the tip.
perfect.
Right there.
Fantastic job.
Cut
You
him
want
off.
to do
Hooray.
All right, get in there. Boop, boop, boop. There we go.
Fantastic job. We're gonna throw away our sharp. All done. Again, it's enough before the end of the day. So.
Sounds good.
Callie, is his cage ready?
I don't know.
Got it.
That was insanely interesting.
Oh, yeah.
On Tuesday morning, we got a really sad case of a goat that was hit by a car. One of our amazing staff members on the media team actually found her when he was on his way to work. And so we brought her into the shelter and checked her out. This is what happened.
She's pretty pale. You're okay. Just move up. I'm going to go ahead and give her some pain meds. Okay, this might taste kind of yucky. Okay, I know, it's so gross. You want some water?
She's been drinking.
Good. Oh, good. Okay, I know. I'm sorry. So Alex, when you listen to goats, normally we don't really hear anything kind of like horses. With her, you hear like a kind of a little bit, and it's more severe on the right, both cranial and caudal, than it is on the left. Okay. And I'm gonna listen to the GI sounds while you listen there. Full staff members from our media team noticed that this goat was in the road on the way into work today. She was in the middle of a dirt road separated from a herd. And our staff member saw some blood in the road, and there was evidence that she had urinated in the road and she wasn't getting up, which is very abnormal behavior for a goat. So some members of our staff went and picked her up. That team has got small animal surgeries this morning, but we wanted to make looking at her a priority because we don't want her to be painful. So on exam, we do note that she has presumptive pulmonary edema, which is fluid in her lung fields. I hear it on both sides, but more on the right than the left. She does have trauma on both sides of her body. It reportedly, and I haven't looked at the right side of her body in the hind end, but they think that she may have a broken right hind leg. And then the left side of her face has a lot of abrasions and swelling. So I'm concerned that she may have a fractured mandible, which is her jaw. On this left side, we're gonna take some x-rays of her head and her lungs and her leg and kind of make a plan from where to go forwards. We are in a position where we don't legally own this goat. This is a stray animal. So as a veterinarian, I can provide care. I can legally give this sweet little thing some pain meds. So we gave her some anti-inflammatory pain medication to help. She is systemically stable, although she's very pale at this point. So she does have some epistaxis, which is a nosebleed, probably related to a contusion in her lungs or related to something going on up here. But she isn't in respiratory distress. Her heart rate's a little bit elevated, but it's not through the roof. So that's one of our best indicators of level of pain. She's really calm. She's letting us help her. She's drinking. So we're gonna go finish up our surgeries, let her pain medication kick in, and then we're gonna come back and do some more diagnostics on her. And hopefully we can get some pictures of her out quickly, and maybe we can find her owner, because we wanna be respectful, not to do anything with somebody's pet. She seems very sweet and comfortable with humans, so I think she is someone's pet, and I think she's a little Nigerian dwarf. Have we named her?
I don't think.
Okay. She doesn't.
Is that what they named
Gertrude?
Gertrude.
Oh, Gertrude. That's a
That
great
fit her.
name, Gertrude. So yeah, she is comfortable. We're keeping a really close eye on her, and we'll let you know when we know more after we do those diagnostics. Still pretty pale. Smelling pee-pee. Can you reach the water? Every time I try to do husbandry things, I just make it worse. This little patient is Gorude. I don't know who named her that. I thought her name was Gertrude, but one of our staff members saw her in the middle of the road driving to work this morning, and it looked like she had been hit by a car, maybe. She was down in the road and unable to rise, and she had a pretty swollen, her eye actually has improved a lot over the day today. So this left eye was pretty swollen, her jaw is swollen, she was bleeding from her nose. And so we brought her to our hospital. We're doing our best to locate her owner, but so far as I know, we haven't identified an owner. We believe she is a young Nigerian dwarf goat. She seems really calm. And so I think somebody's cared for her. She's a female. And where we are today, at the end of the day today, is that she has a broken pelvis. So the pelvis is kind of like a rectangle, and her pelvic fracture is between the acetabulum of this hip, so the ball and socket joint where the femur attaches, and the back wing of the pelvis, the ischium. So there's a fracture kind of right here behind this. The good news is fractures that are in the acetabulum are a little bit more painful. So its location is better for her from a pain perspective. The thing that I am the most concerned about with her is permanent nerve damage. So this right hind leg is a little bit cool to the touch, and she doesn't have proprioceptive placing, which means her brain doesn't know where her leg is in space. So she can still move it somewhat, but there's evidence of damage to the nerve that runs to this leg. So even if your bone heals, if your nerves don't work and you're just dragging your leg around, usually what we end up having to do is amputate that leg. She also is quite pale, so she doesn't show evidence of ongoing hemorrhage. She's been stable throughout the day, but she is pretty pale. I know, mama. And she's had some great pain medication, but obviously she has a broken pelvis. So we have her on an orthopedic dog bed. And we're going to try to keep her as comfortable as we can and try to find her owner. There are certain things that we can do in veterinary medicine to provide care for animals, but we can't go forward with kind of radical medical care unless we have an owner's permission. So I think it's a 3-day mandatory hold, but for right now, she's relatively comfortable. We brought her into our equine hospital, into a room that's air conditioned because it's so hot today. We wanted to try to minimize stress. She is drinking really well, which I'm happy about. She hasn't been very interested in eating, and she's just been really tired and sleeping today. So hopefully Gorude pulls through, but we're gonna take it a day at a time.
So this is Legend. We got him a couple weeks ago, and unfortunately he was too crazy at the time to do his intake, and so we decided to do it now. He was pretty skittish, so we were being really quiet with him, but we were able to do his intake. Dr. Lydia is shaving his neck a little bit to do his microchip, and then we also took some blood and gave him some vaccines.
So there are some breed standard microchip locations for horses, but I think the most universally accepted is just left neck. We do it straight into the nuchal ligament.
Oh,
And
okay. How do you actually find
Which little bark?
alcohol. Very low rate of problems, but if you can do like a little clip in alcohol ahead of time, I do think you'll have a lower incidence of reactivity, but it's also can split up the injections. Alex, when I do foals, I do this a lot, because like, you go come in and flip out. Or true. like, and you gotta like
really push.
you gotta really push. You can't get through it slowly. I mean, literally, like I do this and I like thunk it in.
And you gotta be ready to
I already
stand
press.
push.
I already took your blue thing off.
Okay.
These are not expensive. If you mess it up, no one will mind.
And if it doesn't go in, it doesn't matter.
Definitely do the
Definitely
taps.
done that.
Yeah. Yeah.
Good job.
Oh, poor thing. All right, so we tracked down, well, technically they tracked us down, but we found Gorude's owners. I'd made a post on our local town's lost and found page saying that, an employee found this goat. She'd been hit by a car. And this morning, we got a phone call from a couple that lives down the road. And they said that they had a herd of goats and was missing one, and asked if they could come and see if the goat we had was theirs. So they got here. They just left a few minutes ago. She is, in fact, their goat. Due to her injuries and the fact that she's going to have an extensive recovery period and have to be cared for around the clock until she's able to get up on her own again, they decided to surrender her here so that we could continue her care until she either goes into a foster type adoptive home to finish her care. We're not entirely sure what that looks like, but they did decide to surrender her. They did love her. And they made the best choice for her because they weren't able to give her the time that she needs to recover. So she's going to be here with us until we find somewhere else for her to go to finish out her care. Hi. I know, you poor thing.
We have a really sad update for you guys. This is Gorude. Our wonderful staff members saw her in the middle of the road early in the morning on Tuesday. And she was down and there was blood and urine in the road. And so our staff went and picked her up. On Tuesday, we identified that she had a really swollen eye, some swelling in her mouth, some fluid in her lungs, and a fracture in her pelvis. So the pelvis is kind of like a box of bones, and then off the side of it, the hind legs, the femurs kind of attach in the hips. So this was a great learning experience. Poor Alex. So Alex is our wonderful senior veterinary student here, and I'm so thankful for people fresh out of school because they help us learn new things, but also help us miss things. So we had a busy day on Tuesday. We took radiographs. We saw a great view of most of the pelvis, but not all of the left side of the pelvis. Saw the fracture and we were like, there it is. There's our fracture line. And so we designed a treatment plan. Our staff worked really hard and were able to identify her owners, which we're very thankful for. They were a lovely family and they were able to come say goodbye to Gorude. But they didn't have the capacity to provide her with veterinary care that was needed, so they surrendered her to Horse Plus. So today, in preparation for our weekend, one of our staff members was going to take her home and care for her. She's not able to get up. And I said, let's recheck that pelvis and that fracture before we move her and send her anywhere. And unfortunately, in performing that recheck exam, we were able to get a better view of the pelvis, and we found a second pelvic fracture. So that is really important because if you think about a square, if you have a break in one point of the square, you still have stability provided by the rest of it. But if you have a break here and a break here, then you have two separate parts with no stability. So that's exactly what happened with Gorude. So yesterday when we had a little bit of a fracture that was like this, our exam today was like this, where we have had the pelvis actually moved on both sides. That's important because if bones are lined up enough together that the marrow cavity and the exterior part of the bone and all of those stem cells that create bridges, if they can talk to each other, they'll make a bridge and they'll heal a bone. There's a joke with cats that says, put the two bones in the same room together and they'll heal or something like that. But what we want with fracture healing is for really good apposition of those two bones. And yesterday we had pretty decent apposition. I went, this one fracture line, we got a good chance of it healing if she just rests. Today that is no longer the case. Without placing extensive plates and screws, which is orthopedic surgery, you open the whole area up, you get a sterile stainless steel plate and you screw it into place to stabilize those. And if you've ever had extensive surgery on your pelvis or somewhere else, you see those x-rays with humans. That is not something that we have the ability to do here at Horse Plus. We're a general practice. I'm a GP. So I would never attempt that procedure on an animal. I've never done that kind of surgery. I'm not qualified to do that kind of surgery. And it would have to be done on both sides. So we took a decent prognosis to a very painful displaced fracture with no chance to provide her with the care that she needs here at Horse Plus. I'm so thankful that she didn't pass in the middle of the road. She had great pain medication. She's been on a nice orthopedic dog bed and she's gotten a lot of love and care and got to say goodbye to her family. So we are making the decision to recommend the last act of kindness for Gorude. We do not want her to suffer, and her pain is going to continue, and her chances of those bones healing went from pretty good to almost zero. So not the update that we wanted to give you guys at all, but that's also why we're here. I'm thankful that we got answers and that we're able to give Gorude a last comfortable morning and some groceries. She started eating again. She wasn't eating at first. She's eating now. So we've seen some improvement and we're going to say goodbye.